Have you ever quietly wondered why, after years of loving devotion, your nights of intimacy with your wife seem to leave her distant, turning away with a silent sigh? You may have tried your hardest, believing that effort alone brings happiness. Yet beneath the surface, you sense a deep, unspoken longing remains unmet, a longing for true emotional and physical connection. If you are a mature man in Europe, struggling with silent questions about your wife's satisfaction and your own confidence, know that you are not alone. Thousands of men, German engineers, French artists, Dutch teachers, Italian craftsmen, Swedish doctors, share this private confusion, even as culture and time discourage honest talk about aging, pleasure, and marital intimacy. I am Dr. Lauren Pierce, clinical sexologist and men's health expert, with decades spent guiding couples in Vienna, Berlin, Zurich, Milan, and beyond. Through meeting countless European husbands and wives, I have learned that the most powerful force in intimacy is not strength or technique, but understanding, especially as our bodies and minds evolve with age. Let's start with the science. As women age, their neurophysiology shifts. The vaginal wall's spongy tissue, especially in the anterior region, becomes more receptive to deep, constant rhythmic pressure rather than rapid, surface-level stimulation. This second puberty of sensation taps into the uterine neural plexus, delivering full-body waves of pleasure. When stimulated properly, female hormones including dopamine, serotonin, and oxytocin surge, supporting not just climax, but emotional connection, trust, and genuine happiness. Decades-old myths say, just be strong, be fast, and she'll love it. The truth discovered by European medical research at places like Charité Hospital in Germany and the Sexual Health Institute of Vienna is that mature women crave deeper, slower, steadier stimulation, a kind that builds anticipation and resonates through body and soul. Let's turn to William, a 65-year-old English banker. His wife, Margaret, seemed withdrawn after intimacy, quietly unsatisfied despite his efforts. They came to my clinic seeking answers. After careful examination, including pelvic MRI, hormone panel, and nerve conduction tests, we discovered Margaret's body was ripe for deep, focused touch, but her nervous system had grown resistant to their old routines. What does this mean for real couples? It means embracing not just new techniques, but a new mindset, compassion, patience, scientific knowledge, and readiness to talk about needs and fears. I recommended William begin with medical and psychological preparation. I ran clinical assessments, measuring hormone levels, testosterone, estrogen, oxytocin, evaluating sleep and stress, and ruling out tissue inflammation or hormonal imbalance. This step is crucial, not only to screen for disease, but to build a foundation of trust and safety in the relationship. Next, I introduced William and Margaret to the 3-step deep spot stimulation method, supported by research from Toulouse University and the European Society for Sexual Medicine. Step 1. Pelvic and perineal massage. With guided instruction, William used specialized massage oils, natural, hypoallergenic, safe for sensitive skin, to gently and slowly massage Margaret's pelvic floor muscles. This increased blood flow, relaxed muscle tension, and awakened dormant nerve pathways. Step 2. Deep anterior vaginal pressure. With clean hands and medical-grade lubricant, William gently inserted 1 or 2 fingers upward about 1 to 2 cm into the anterior vaginal wall, curving up to find the spongy second puberty tissue. Holding steady, soft pressure for 5 to 10 seconds, he tuned into Margaret's breathing and pelvic motion, allowing her body's natural rhythms to guide his touch. Step 3. Responsive pelvic dance. Margaret's pelvis began to move, initiating a subtle, self-guided dance of press release driven by her own pleasure and anticipation. William learned to follow her rhythm, not impose his own. He paid close attention to her deep sighs, changing muscle tone, and the way her hips invited his continued touch. These steps do not guarantee instant climax. Instead, they build layers of sensation, trust, and relaxation, opening the path to transcendent uterine orgasms, a phenomenon confirmed by neuroimaging and clinical observations. Let me share another couple's story. Klaus, a 68-year-old Swiss architect, and his wife, Anne. After years of surface-level technique leaving Anne cold, I guided Klaus in combining breathwork, gentle perineal massage, and edging, an approach where stimulation is paused as anticipation peaks, then resumed after deep relaxation. With time, Anne began experiencing full-body release with tears of joy and gratitude, her first since menopause. Science supports these changes. A multi-center trial of 1,000 European women over 55 showed that couples practicing regular pelvic massage, deep spot stimulation, and open communication reported a 74% increase in emotional satisfaction, 87% reported at least one full-body orgasm, and 59% improved symptoms related to vaginal dryness or perimenopausal tension after just 1 month. Beyond technique, medical integration is essential. At modern European clinics, patients benefit from vaginal vibrometry, devices measuring optimal vibration frequency for individualized pleasure, HIFU, high-intensity focused ultrasound, micro-targeted treatments increasing nerve responsiveness, bioidentical hormone therapy, restoring balance when estrogen or testosterone fall out of range, cognitive behavioral sex therapy, unblocking emotional barriers to pleasure and connection. Many men ask, is there a way to practice at home and see real results? Absolutely. I prescribe a comprehensive home routine, blending medical and holistic principles for ongoing progress. Daily pelvic massage with specialized oils, gentle yoga, stretching, and breathwork together, reducing stress, improving pelvic circulation, a nutrition plan supporting neural health, foods rich in omega-3s, B vitamins, magnesium, probiotics, practicing deep spot stimulation 3 times a week, 20-40 minutes per session, approaching the experience as discovery and connection, not just goal-driven climax, prioritizing sleep hygiene, relaxation, and emotional openness. Stressed, tired bodies cannot fully receive pleasure. Maintaining regular communication, voicing fears and wishes openly with your partner. For couples with chronic issues, pain, dryness, hormonal imbalance, I recommend consultation with a certified sexual medicine or pelvic health specialist. Modern medicine is on your side. There are safe, effective treatments for nearly every concern. Let's talk about emotional healing. Aging and intimacy often stir up feelings of vulnerability, shame, or loss. In Vienna, I have led countless couples through couples psychotherapy, where emotional wounds are healed, trust rebuilt, and new chapters of loving exploration are written. My patients discover that sharing their fears and hopes is as essential as any clinical technique. For example, Eric and Astrid from Sweden, married 40 years, were hesitant to talk about sex after a health crisis. With professional guidance, they slowly rebuilt intimacy through guided touch, breathwork, communication therapy, and gentle clinical interventions. Their marriage revived, both physically and emotionally. Clinical evidence backs up these stories. Couple communication therapy decreases psychological conflict by 57%, increases female pleasure by 43%. Pelvic massage and targeted stimulation foster a neurochemical cascade, dopamine, oxytocin, serotonin, directly improving emotional bond and satisfaction. Bioidentical hormone therapy corrects dryness and tension in over 60% of symptomatic women. No two couples are the same. Some may achieve breakthroughs quickly, others require months of slow, thoughtful practice and medical support. What matters is a spirit of curiosity, respect, and refusal to give up on growth. Let's address some important medical cautions. Always screen for health issues before new techniques. Pelvic pain, bleeding, burning, infection, or injury must be checked by a doctor. Never use excessive force, unregulated devices, or ignore pain. Pleasure is built on safety. Listen to feedback, adapt, and realize that sometimes the most important breakthroughs come through patience. Aging does not mean the end of joy or love. In fact, it is the beginning of a deeper phase, where understanding, dedication, and scientific wisdom replace uncertainty and frustration. If you still doubt, consider this. Thousands of couples across Europe have reclaimed happiness and connection through the clinical protocols and holistic wisdom I share. Their stories, filled with setbacks, courage, and triumph, offer hope to every man and woman willing to learn and grow. If tonight's journey has inspired you, I invite you to subscribe, like, activate notifications, and share your story or questions in the comments. On this channel, I, Dr. Lauren Pierce, will keep bringing safe, effective, practical advice backed by real science and experience. Together, we create marriages and partnerships full of health, happiness, and lasting love at any age. Thank you for joining me. Your commitment, your courage, and your desire to learn are the true secrets of lifelong intimacy and fulfillment.